their frontline staff, and they're doing lots of campaigns and improving signage. And over a 12-month period recently, 2,500 offences were reported, which sounds, it is a lot. I think there's about 25 million journeys per day in London on the transport system, and the data collected actually increased in those 12 months, which, you know, immediately you think, well, that's a negative story, but when they've analysed it, they believe that because of their better communication, sort of reporting mechanisms, and they're really trying to get bystanders to intervene where it's safe, that this increase in reported offences is because there's a greater awareness of how to report, and therefore the data's increased. But it's quite a complicated picture. It isn't always for one particular reason, but it does show that you do need data, otherwise you really aren't going to be able to take the right direction. Lots of barriers, of course. Resourcing is always one of the main ones, and data, as I mentioned, I think is one of the most important. But the barriers are from the transport provider perspective and the transport for the provider. One of the best things we did over the last couple of years is to deliver cross-sector workshops in Blantyre and Kigali and Abuja, and we brought together policymakers, transport providers, NGOs, the police, all together in one room. And it was the first time that had actually happened, that sort of mixture of stakeholders all in the same room. And it was only there that they could discuss their particular barriers and opportunities, and really understand what each other's roles are, because there weren't existing forums to have that discussion. So it's important that the stakeholders know, where their competencies sort of begin and end, so that where people can work together. From the transport user perspective, lots of barriers, one of them being a lack of clear reporting systems, but things also down to vehicle design and overcrowding. And we know of solutions, and we'll talk about the tool later, but we've collated lots of case studies where action has been taken. And sure, you can improve lighting, you can deliver campaigns, you can help design out the possibility of sexual harassment, such as through female-only carriages, improving diversity in the workforce in public transport, and using new technology now with apps. You can sort of live report incidences, and that can create like a heat map. And a single measure is better than no measure, but the real impact comes when you integrate numerous interventions together at the same time, and that means bringing the stakeholders together who have responsibility over those different interventions. And what we found during our studies is, broadly speaking, there are 5 stakeholder category groups, which have power and interest in tackling this issue. And some of them, their competency is more in a proactive sense. So that could be the policymakers, the people drafting the laws and the protocols and the regulations. So that's more upstream to try and stop it from happening. Then you have more the reactive stakeholders, and that could be the enforcement agencies in terms of responding to incidences. And then you have some stakeholders which have a bit of both. So transport providers can be proactive by through vehicle design, for example, or they could be reactive by having reporting mechanisms and hotlines. And working alone, one stakeholder can make some impact, but again, it's when you start joining those stakeholders together, you're going to have a more strategic program of joined up measures, which is where the benefits really come. So even when you know which measures might be useful for you, for your city or organization, there are still some barriers. So which measures are going to be the most effective, or which combinations might have the best impact? How do you get stakeholders to work together? Are there any case studies that can be signposted? how much will certain measures cost, what data is needed. So there's still these gaps that need filling in order to make a big change. And that finally is where our Shikan tool really comes in. It's an online tool, and we've developed it over the last couple of years, and it really allows all those stakeholder types to, first of all, if there is no data, there is a step-by-step process of how to get qualitative, quantitative data. And then you can use the tool, you're taken into different interventions that are the most effective. You can search by which are perhaps the cheapest to deliver for quick wins versus higher cost ones. And also you're directed into which stakeholders need to collaborate in order to get successful outcomes. And there's lots of case studies in there which really help set a precedent. And whilst it's designed for African users, it's very much transferable to worldwide. We'll look at this more in a second, but the intervention categories are these. So again, if you're, depending on what stakeholder you are, some of these interventions are going to be more within your remit than others, but this is how you search for interventions which are suitable to your organization. Then just before moving on, so over the last 6 months or so, we've had this really exciting initiative where we've invited what we call the national contact points to join the project. And they've been piloting the tool. They've been rolling out initiatives in their countries to tackle sexual harassment in different environments. And we've got members from a number of these here today, and they're going to be presenting. I'm very grateful for them to be here. Actually, just a moment. Is Bethlehem in the room? Oh, you're there. Brilliant. It's good to see you. Thanks for coming. And over the last 6 months or so, they've been following this sort of 5-step approach, which has been working really well, where first of all, we've trained up the contact points on the tool and the various services it can deliver. Then they've done a stakeholder mapping exercise, working out who has the most power and influence in this domain in their countries, and then invited the key stakeholders to a workshop where they brought them together. They've got common purpose, and then step 4 is to develop a roadmap. So looking at what policy exists, where the gaps might exist, what the opportunities are for taking this forward. And then what's happening right now is the pilot activities, and we'll hear all about these later. But the contact points have been using the tool's resources to help guide them in collecting data, doing passenger surveys, delivering campaigns, doing driver training, lots of really good initiatives. And this really comes from using the tool in the first place. Cool. That's me for now. I'm passing to Mariana next, I believe. And so we're going to look now a bit more about the components of the tool.
Thank you. Before I start, any questions to Paul? So thank you, everybody. Yeah, and sorry, I start to lose my voice, so I hope that this will be clear. So the tool itself, what we did is we did do a lot of research, what needs to happen, etc. And then one of the big aims of the first phase of this project is how are we going to share all the knowledge that we have been able to gain with Africa, with people in this field. So that's the real difficult thing that we identified. So we decided to develop the sexual harassment engaging, changing attitude meetings and needs, the Shikan tool. And it's a web-based tool. We can't call it a website, but it's a web-based tool to help decision makers tackling sexual harassment in public transportation, And if we talk about public transportation, we're very aware that the journey for users when using public transportation is walking to wherever the vehicle or the train comes, waiting for that vehicle to arrive, and then being in that vehicle. So we're very aware that it's not only when you're sitting in the vehicle that you are vulnerable, vulnerable as a woman, vulnerable as a girl. The tool is designed after extensive research in the African context. We have done interviews, we have papers written on the results of that. We made sure that when we started to communicate, and I think we have, I must say that the designers have done an excellent job on this tool. If I may say so myself, that wasn't me. It's user friendly. You connect to the tool quite quickly. It's applicable in all of Africa, and I would even dare to say in most of the rest of the world, although the focus at the moment is the African continent. And there are a lot of case studies from all over the continent, as well as other parts of the world. As I said, it's easy to use, it's tailor-made, and it's tailor-made for different stakeholders. I will say more about that. So if you are a municipality, we have a specific pathway through the tool to give you information. If you're the operator, the pathway that we have designed is slightly different. And you can use the tool on any of the devices that we're currently using. And I'm dare to say that if there are new devices coming, I'm sure we would be trying to at least convert it to that format as well. In the tool itself, there are two entry points. We have the take a decision and a get knowledge part of the tool. The get knowledge is very general. We don't have a stakeholder in mind when we are guiding you through that. You can explore all the resources. There are templates for how to put up a questionnaire, what to do. If you are asking people about sexual harassment somewhere during their journey, or even when they are in their home or in focus groups, then, for example, it's important that you might re-traumatize people, and we suggest that you at least have a number for a specialist that can deal with that trauma, and or somebody on site that can assist as that re-traumatization is happening. The other side, as I said, special pathways for the different stakeholders. This is what the entry page looks like. So get knowledge, for example, what are the interventions? There are buttons on what is the most successful intervention for women, what is the easiest to implement, and you can click on a button and get then that information straight out of the tool. Or if you're taking a decision, you're one of the 5 stakeholders that were already introduced by Paul. You could be an NGO in the legal frame, a municipality, a transport authority, or enforcement agency. I need to make sure that I remember them myself all. So those are the 2 main entry points. And as I said here, local authority, enforcement agency, NGO, policymakers, and transport providers. And what can they do specifically? What are the barriers? Who do they have to collaborate with to actually implement the things that they need to do and can do? If you are one of the stakeholders, you are responsible more for the legal side, then you will see that, and sorry, I don't have a pointer, but for example, at the top, you see legal, and then you see in blue all kinds of interventions that can happen. So this way, per category, you get information, and that's the same for surveillance and policing, infrastructure, etc. So some of them have more vehicle design. There are things that you can do as an operator, but you're not the vehicle industry. So redesigning your whole vehicle is not what is in there, because that's not the type of stakeholders we're looking at. But the fact that you can order a vehicle that doesn't have tinted windows so that nobody can look in and provide a bit of safety from the outside is something that is in your possibilities of what you can do. So it's tailored information, it's categorized. There are key details, and it's in 3 simple steps that you can get to that knowledge. When you get to that knowledge, then there are 13 different aspects that we are telling you. So now you are at an intervention, and we will tell you what are the type of stakeholders that you collaborate with. We have a pyramid of knowledge that goes from the base to being empowered, and we tell you this intervention is on a certain level, on that 3-layer level. And of course, the basics need to be right before you should be working on the empowered level. We have a whole lot of literature, and we will tell you for this specific intervention, we have been able to find African information or South American information, global information. We tell you what it is, and at the bottom of the page you find all the references of the information that we give you. And then there are the ease of implementation, descriptions, etc., etc. A lot of information. As I said, 13 different things that we provide to you per intervention. There are additional filters. We provide relevant articles. We provide and we update articles that we find along the way. If I find something, I send that straight on to the developers, and a week or 2 later, it's available. If we do work ourselves, we make it available there as well. The whole empower data collection process is described, and as I said, tips of how to deal with certain things, how to design a questionnaire, the template for the pictures, which took a long time. I think there were quite a few iterations to actually get that to a stage. It looks simple now, but there's actually a lot of work that went into that. Yeah, all kinds of templates, as I said, and the results of the project itself. For decision making, you can select the information per stakeholder. You can select the information on the different layers in the framework that we have. So as I said, from the basics to being totally empowered. Per intervention category, so it can be infrastructure, can be legal, etc. You can look at what is, when do I get quick results? So your identification of the low-hanging fruit, you can do through the time frame. Ease of implementation, the impact on women, and the area of impact. Is it going to be only a station? Is it going to be a suburb? Is it going to have an effect on your whole city when you do something? That's something else that we have included. And you can go through the decision making and click on it and get all those different things. So if we look at the SheCan data collection guide, and then there is the SheCan data collection guidance. I have mentioned that before. If we are looking at the information that we have there, then there's data collection for passenger surveys and templates for that. There is data collection for focus group discussions and how to do that and what to implement. There is information on stakeholder mapping, and that has been used by the local committees around Africa now in this phase 2. How to do a workshop, and I hope that this one goes well, and the findings that we have already. And please also, if you start using this tool and you do something, send it to us, send your results to us, because there is nothing more rewarding for us to actually have you using it and sharing your findings and being able to share that with the rest of Africa and the rest of the world. So please do send the information to us. If you look at the data collection for passenger surveys, there is guidance on the process of developing that, how to sample, how to recruit and train people to do it, the locations where to do these surveys. Of course, we need to be ethical, so always make sure that you have ethical approval, doing the things that you are doing, and how to analyze that data once you have it. As I said, the pictograms, that took much more than just coming up with a few figures. There were many iterations, very useful to use in these passenger surveys. We always start with, are you willing to actually participate, and then try to get the information of what happened. With regards to the focus groups, the planning and recruiting of the focus group members is really important. We provide guidance there as well. When you're running focus groups, it's incredibly important that everybody has their say. So how do you deal with that? And then we have suggestions on topic guides, questions around sexual harassment and how to phrase that. And of course, that needs to be adapted to the different countries around Africa, because some of the cultures are different. So of course, everything needs to be translated into your local context. If we're looking at mapping, we look at who are the agencies that are important, who are the stakeholders, how can you get information from them, what their role is, what power they have, what interest they have. One of the things that I did a lot of work on during my master's, what are the hidden agendas? They're always difficult to get, but think of that as well. Then how we have some guidance on ranking information and including examples. There's a whole template for that, and we take you step by step through it, and we have contact points as well. We have these African contact points as well. We're always happy to talk to you if you get stuck. With regards to stakeholder workshops, it's important to identify the stakeholders. Then we have templates for invitation letters, the objectives, how to put an agenda together, what topics to discuss, etc., etc. So you're guided through this whole process. And then findings, how to present findings. As I said, we always very keen to share your pictures, share your findings, help you summarize that into a small paragraph. If there is a lot of work that you have done, we're happy to guide you through how to get that published and maybe what journal to put that in if you are in an academic background. And again, we are happy to share all that information, and we have also shared our full texts. And then the online demonstration. Now I have to, is there the link? So what do I do now? To just showcase to you. Do you want to take over to do that, or should I?
Put the website in.
Yep. There we go. Thank you. It's an African tool. So the other thing that I think that the designers have done really, really well is to give this tool also an African feel. I think the pictures that I use are actually phenomenal. And this is not my my laptop. So here are these two buttons that I showed you. It's right there on the first page as soon as you put She Can Tool. And if you search for She Can Tool, it comes up straight away. On the first page, you will see some video material, some background on the project, etc., etc. Lots that we have provided now. And then, and if you go, and I'm going to assume at the moment that most of you around the room have a certain role, so you want to take decisions on where to go, then we want to know what type of stakeholder are you? Are you a local authority, a policymaker, an enforcement agency, a transport provider, or an NGO? And then when you take one of them, and I'm going to take local authority, then your local authority, well, we have identified, and we have 48 different interventions. We have already identified a 49th one that will be added to the tool, and we're hoping to find a 50th one. 50 is a nice number, right? A 50th one. We have added more examples as well, but as your local authority, there are two things that you can do in the legal, with regards to the legal framework. Of course, surveillance and policing, you play a role, and there are 4 interventions. With regards to infrastructure, 9. And there, definitely infrastructure, your local authority is actually the most important role player, logically. So the other side of that, if the local authority is not doing infrastructure well, you have a problem, and your problem will be quite big. I've done and it's not in the public domain yet, a search around the globe of how big is this problem, and what is the type of data of 4 out of 5 women in Germany have certain issues. 4 out of 5 women in South Africa have different, but also harassment related. There is not a country where I found a number lower than 33%. So at least 33% of women have issues that are related to sexual harassment. Campaigning for Vehicle Design 5 and Management 21. There's a lot of management implementations that you can do. And I find infrastructure, but I'm a civil engineer, so I guess that's, we always go back to our roots. What can we do in infrastructure? Reliable connectivity for your mobile phone. If my phone is not working, I can't use any app. Have clear sight lines, so the designs of your underpasses, subways, transport hubs, provide lighting, creating safe spaces for people when they feel uncomfortable, mixed use public spaces, secure toilet facilities, development of sidewalks that are well lit. Lighting is a very important one, and it comes back a few times. And then having emergency buttons, not only on your phone, because in Africa, a lot of people don't want to take their phone out. And we heard that from South America as well. I heard a story earlier this week. So women don't want to grab their phone. They don't want to travel with fancy phones, but then make sure that there are push buttons like we have for pedestrian lights. We've done it for decades. We can also do it for this, and then make sure that there is. So this is just an example. Thank you for that feedback. That is fantastic. We really, we worked hard. It took a while to actually structure this. And in the end of the day, as I said, for every intervention, if I click on one of these, you will see the 13 different things that we have put in. So overall, there are more than 2,000 pieces of information in this website of things that you can do in this sphere. So I really appreciate your feedback and stopping me I really appreciate that. So as you saw in the one slide, we have the different stakeholders. This is in one intervention, the different stakeholders that are involved, that you as a local authority, you're the most important one, but you should work together on this intervention with policymakers and transport providers. Maybe enforcement agencies and NGOs in this particular one are less important. They don't play a big role. This particular one, and I clicked on clear sightlines and transport hubs, is a foundation type of a basic type of intervention. It's not alleviated and definitely not empowerment level yet. We have found pieces of information on this from Asia, Australia, Europe, and North America. Then there is a description of what are we actually talking about. A one-liner is not necessarily very clear. We do need to give it a title, but what are we talking about? And you will then also see the references. So the 2s and 3s, etc., are to do with the pieces of information that we found in the public domain that inform this. Some facts, illustrations, case studies, and where they come from. And in this case, obviously, there's some technical information as well, what that means, and you should also then go to design guidelines. The impact, what area it's impacting. So clear sightlines is something that works for train stations, for bus stations, paratransit, ranks. It works at interchanges, but it has nothing to do with the vehicle itself, and it has nothing to do with walking to and from the interchange type thing. So some of the things will work for everything, and we guide you through that. When does it help? Is it only during the day? Is it at night, etc.? In this case, it always helps, no matter if it's peak time, off-peak time, morning, or let me just go off this. What are the typical vehicles where this works? Now you can see there. What are the demographic groups that are informed? So although this is a tool that focuses on the security of women and girls, we do know that, the elderly, maybe boys, maybe men themselves also might be benefiting from introducing this. The resources used, and there is a description as well. Is this capital intensive? Infrastructure is fairly capital intensive, and this is a qualitative indication. We don't have numbers to it, but they're all at least compared to each other. So if it says 3 here and 2 somewhere else, there is a significant difference in, for example, the capital investment that is required. And costs are different in different regions, even in different regions of Africa. The operational cost on an annual basis, then you can click through. I'm not going to do that elaborately, but you can click through what the strengths, the weaknesses, the opportunities, and the threats are. So with one click on the button, you can find that information. The effectiveness of it, and then we have done that with regards to how effective is it for female passengers or travelers, for government to implement, as well as how confident are we? We are basing ourselves mostly on literature. How confident from that are we that the previous 2 are actually picked at the right place? If we only have one source, then we are less confident than if we found 5 sources that say more or less the same. So we share that knowledge with you, and we might adapt that as we get more information. How long it takes to implement? As I said previously, where the intervention is effective. So in this case, station and suburbs, maybe it has an influence on the city itself. If you do that more elaborate, definitely not regional or national. It has nothing to do with that in this case. The ease of implementation, and then you get the list, also categorize in what region the information came from at the bottom. And for every of those, at the moment 48, hopefully in the future 49 or 50 interventions, we have this type of information. So please use it. It's there for you to use. Paul, do you want to go anywhere else in this? Do we need to go to the other resources? And do you maybe want to click through that? There we go. Yes. Then you say transport operator, and you get the same type of information because if you have minibus taxis, they are the operators. So then you can see what the operators should be doing, and then say, yes, informal is a taxi. Yeah, informal is the taxi. Yeah. Thank you for your question. You want to do the other side?
Yeah, just quick. You probably covered most of it on the slides, but I'm a little bit obsessed with the data collection facilities on the tool, because it really is like a step-by-step. So it tells you a step-by-step approach of delivering passenger surveys, but also stakeholder focus groups and workshops. And then, as shown just before, this is where all the, I haven't used a map book in ages. This is where all of the downloadable templates are. So you really don't have to spend much time in designing your own passenger survey or a topic guide, discussion guide for a stakeholder workshop. They're all in here, ready to go. Of course, you can edit them as well, but it really does speed up that process and reduce the resources needed to deliver these activities, which is a important factor. And I think that's probably it on the tool.
All right.
Thank you to Mariana.
You stay there and we both answer questions as they come. I saw some. Lydia first.
Yeah. Thank you for the wonderful presentation that you did. Very, very good. My question, you both mentioned that you did a research, and part of the sample is speaking to the women. So my stance would be more into inclusivity. I would like to know, because we have a special people, the women or people with disability, and they could be facing unique challenges as far as sexual harassment is concerned. So my question, I feel like it maybe it was there, but I want to know if it was silent in the presentation. Did you really consider hearing the voices of persons with disability, and also in the tool, how, like I'll give an example, a woman who has blindness and she has experienced such a situation, did the tool consider her, and how do we go about her? Yeah, so maybe you can speak about accessibility components in the tool. And the other question that I wanted to know is, usually they say to address a particular challenge, you need to involve the perpetrators into the conversation so that we are able to solve it. So my question is, how do you, as stakeholders, how do we involve potential perpetrators? Of course, there's an ethic issue with that. So how do maybe you can speak through that? Thank you.
All right. Before we answer, for the people online, the two questions summarized are: do we also consider people with disability, specifically, for example, a blind woman? And the second question was, are we talking to perpetrators? What is in the tool with regards to the perpetrators or potential perpetrators? You want to take it first?
Gosh, they're really good questions. On the perpetrator question, the interventions in the tool are really born out of case studies that we found worldwide, but particularly in Africa. And there is around the category of campaigns and education. That's the category relevant, I would say here. I don't think we've come across an example where perpetrators have been brought into we've got the focus group guides, but I haven't come across an example, a very good suggestion of an example where they're brought in to understand that what they did was wrong and understand what the definition is.
Yeah, but there is an intervention that is training men and boys around masculinity. So it's maybe a little bit broader than not, and you say already there's an ethical issue, how do you know, etc. And the police can't share who the perpetrators are with you, but there is training interventions on masculinity and how you actually should treat women in general type thing. So I hope that that answers that question.
Yeah, that's a good one.
Yeah.
And on disability, again, when we look at the type of transport user, and you would have seen on the slides, women, men, boys, girls, we have lots of different types. Do we have disability on that? I'm not sure if we do.
No, we have elderly women to have, that extra vulnerability. Maybe, women with disability would be another category that we could look at. And that's maybe a note that we need to make for, version 2.0, that we need to add that. I agree with you that we should also investigate much further what their special needs are. I know some girls on crutches and how they are treated is like appalling, absolutely appalling. So it's a very special, specific group. I do think it fell a little bit outside of what we could do in this. The aim was to get this tool online. But I think having extra work done in that direction and then adding it to this tool is definitely another place where we could add things.
One thing that we can do quite quickly, though, because we have a guide on sampling, like how do you get your target audience together in terms of the surveys, but also the passenger focus groups to get the more qualitative information. In terms of the sampling guide, we can make sure that that's included, because we did have a male only, female only, mixed focus group, so 3 different types already, to make sure we get that kind of breadth of insights. But in the guidance, we can include recommendations for also inviting those with disabilities into the group to get the full picture. So that's a really good suggestion. Thanks.
I know Michelle, I see your hands. Michelle had her hand up first.
So I know you have the little questionnaire, but it would still be up to the operator or the municipality or whoever to download it, get it, and then go and find those people to interview, right? Now, are you guys looking at something that's perhaps more accessible to the person sitting on the bus or the minibus taxi, like having something on here where they can just log an incident, it has a GPS coordinate, and keep it simple, 3, 4 questions, what mode of transport were you on, and then like kind of what happened, or different things, or little. For sure, that's a quicker, easier way to get that data in questionnaire, paper.
Before you answer, so for online people, the question is, besides the stakeholders that have been presented, is there another way to get to the user directly and have maybe some quick questions that they can answer while issues transpire?
So that sounds like a really good suggestion, and it would probably come under the responsibility of the public transport authority, the transport provider, I would imagine, as a bus user, to have an app related. I don't know, Shayan, who works for Lamata, whether the public transport authority in Lagos, that would be something that they would consider having an application or a website where you can, as a transport user, report how was your journey today. And maybe it's more open-ended, but you could include a particular question on that, as you say, for like live data coming in rather than like an annual survey, which is just one point in time.
Yeah. places, but also just meet so many people. And I don't see them obviously coming out with something like that from off the rail.
Yeah.
So the question is, how about informal transport? You can do that. It's easy to implement something on formal buses, but it might be much more difficult on informal transport. That's true, and maybe we need to help things along. It's quite interesting that it's actually not true that informal transport is the worst. It's other part. The train is actually the worst, especially in this country. Is the worst.
And there are quite a few apps out there that we found, and they're included as case studies on the tool, where you can report live. Like Safety Pin is one. There's a couple of others as well. And I think the World Bank was trialing one in Dar es Salaam, particularly with students, to sort of test it. But so the app isn't specific to the Transport Authority. The app is much wider and can be used in different countries, and it is GPS based. So you report the incident, and it takes that into account where the location was. That's particularly relevant for outside the vehicle, so walking to and from. So that sort of street based incidents in particular. But there are some examples in there, and yeah, it's a really good question as well.
Thank you. Oh, lots of hands here. While the hands are going up and I give people an opportunity, can we get some thumbs up that everybody is audible on the digital side as well? Bernard is monitoring that. The two of you were first. I don't know who was first between the two of you.
Same people on different pathways, right? And then the people who can actually action some response are often the workers of the city in this context. So I think it's also a civic mind and a public mind that connects you to an intention or something in terms of how it's planned and then how it's maintained based on eyes on the ground. And often I think we're most connected to reporting facilities to direct change in the absence of an application development. And I can think of examples where that civic mindedness has actually restored the wheelchair access at an intersection, or I don't know how much, but you know, things that people with sticks need to read.
Yeah, the tactile paving you're talking about.
Yeah. You know, think of that if we're not people with disabilities, but if you kind of are a subject matter professional, I think you're better placed to connect the dots and just laugh at school because you know what it's called and you can access the responses. So that was my point.
Thank you. This was just a comment. Next person.
And how would you assist them, and also assisting them, because we know a lot of the older people are not tech savvy. So how would this app, how would they be able to utilize this app? They're not tech savvy because some of them have a phone, all you do is press a button, say hello kind of thing. So how can we look at assisting them as well? And then the second thing is when you mentioned earlier about panic buttons that we use on the pedestrian crossing, how do we prevent vandalism?
Yeah, so the question is, what about men and maybe vulnerable men, elderly men, and using the information? When we were developing, it was obviously this is a project, and we were asked to do this for women. That was the call, but therefore we have the indication of who can benefit from them, and men are specifically part of that. But we haven't had them specifically in mind. The idea is if you make it work for the most vulnerable, then hopefully slightly less vulnerable people will benefit from the same thing. That's the idea. What was your second thing?
Panic buttons.
The tech-savvy one, that would mean that we as operators and municipalities need to be much more accessible to collect that type of information. It's the same with not wanting to take my phone out in certain places. So I think accessibility, making sure that complaints and problems are recorded, is needed in the local context. The last one
In terms
was
of the sort of vandalism issue, whether it's panic buttons or other things, I guess that's where the tool is useful. Where you combine interventions together at the same time. So one intervention might be rolling out panic buttons, but if you then align that with a campaign educating people what they're used for, and then on top of that you improve surveillance aboard buses, for example, where the panic buttons are, by layering those interventions, then you should be able to reduce the likelihood of vandalism. Because I suppose how I would respond to that.
Paul, how many questions are you going to still allow? Because there was still quite a few.
This is brilliant. This is
left.
brilliant. I would say, because we have a discussion section a little bit later, I think please can you save up your questions and don't forget them, because this is brilliant. And I'm noting down these inputs to feedback, but I think we'll continue with the program, and then we'll bring all those questions back into the Q&A a bit later, if that's okay. But yeah, it's really
Fine.
so.
Then you stay.
Next
and I
up,
go.
brilliant. So next up is Cheyenne Sonoiki from Lamata in Lagos, and she's the first presentation in this section from our national contact points, and how she and Lamata have been tackling sexual harassment within the public transport authority services. And I might need Bernard to use his technical wizardry.
Thank you. It's on.
Are you going to go through it? Just press down.
Thank you. Thank you, and good morning to everyone. It's a pleasure to be here. As Paul introduced, my name is Cheyenne Sonoiki, and I work as a legal counsel for Lamata. Lamata is a Lagos State Transport Agency that regulates formal public transport infrastructure, provides public transport infrastructure in Lagos, Nigeria. So today I'll be talking about how Lamata has deployed the SheCan tool, and how we have benefited from this. In 2020, we had collected some data through questionnaires. We had over 1,000 responses from questionnaires which we collected within a period of 8 months, from October 2020 to July 2021. And this data was collected from the urban public transport users, key stakeholders, and the whole idea was to see the extent to which women's mobility were affected by fears of insecurity and safety in public transport. The methodology that we used were interception surveys, focus group discussions, and we were able to compare data collected via paper methods and also through the tablets. Out of the responses that we received, about 68% of them showed that they had experienced sexual harassment. 35% of these respondents revealed that they had not only experienced it, but then they had seen sexual harassment occur, through verbal abuse, groping, and all of that. The witnesses and victims did not know where to report these incidences, unfortunately. And we also realized that poor infrastructure intensified the feeling of insecurity for women. So safety issues were ignored. Most times they were misunderstood. And there was also a lack of policy infrastructures around the issue of sexual harassment. So a lot of these findings were realized, and there was obviously a need for us to come up with a tool to help decision makers like Lamata make prompt actions to address sexual harassment in public transport. So we had passenger focus groups, and from these focus groups, we realized that there was a clear misunderstanding on what sexual harassment meant. We had various people who understood it to be, it had to be physical, and some psychological, and some, various forms really. So we identified pictograms, which we had seen in Marianne's presentation, that showed us the various forms of sexual harassment which we had agreed could, occur. And perpetrators included passengers, crews, conductors, drivers, and obviously touts. We realized that most of the cases of sexual harassment occurred while passengers were waiting for transport, and it also occurred in vehicles. So it occurred in bus stops, bus terminals, and also in the public transport vehicle. Some of the measures that we identified, which we suggested could help to curb this issue, were the introduction or the increase of safety personnel, the introduction of CCTVs and apps like we had mentioned earlier today, hotlines, increase public awareness, and also there was suggestion on having women-only services. During the course of our surveys, we conducted or carried out stakeholder mappings, and we had categorized this into 3 sectors. So we had stakeholders from the government sector, we had stakeholders from transport, and as well as the NGOs. So all of these came together, in the course of our surveys, and we periodically engage them, when we have workshops, and seminars like this. Okay, so how Lamata has deployed the SheCan tool, we have used this to take decisions. Like I mentioned earlier, we're a transport provider and we're also a local authority. So in the process of using the tool, we fall into the category of local authority and also transport provider. The various interventions, various categories of interventions available on the tool are campaigns and education, management, infrastructure, surveillance and policing, vehicle design, and legal. And we have applied the tool using all these interventions. And I will just briefly show us how we have used this. In terms of campaigns and education, we have done some kind of cross-sectional collaboration with a Lagos State Domestic and Sexual Violence Agency. And this agency is responsible for handling cases of domestic and sexual violence. So we have liaised with them. We have their numbers, their hotlines pasted on our buses and also our terminals and bus stops where victims or witnesses of sexual harassment can immediately report these incidences by calling the numbers. We have also done some awareness raising campaigns, which we call the Speak Up. And this is the link, which is accessible on YouTube. We occasionally have these campaigns done, and we're in the process of updating it. Okay. In terms of management, we have incorporated the use of the SheCan tool into our ISO quality management system processes. And this is where we have identified in various units and departments SheCan champions. And the whole idea of the SheCan champions is for them to ensure that whatever project we are working on, be it internal or external, the SheCan tool is applied, the interventions are applied. So with this, Lamata is able to implement the use of the tool. We have also introduced or promoted the employment of women in bus operating companies. So we have bus operating companies that we have engaged via a franchise agreement. We do not 100% control the operations of these companies, but then we can dictate to them how we want the operations to be, particularly because they are providing a service on our behalf. And so we can say to them a percentage of your drivers should be women. They should have a certain, kind of training and all of that. We have periodic village meetings that we have with them, where we share our the goal, and the idea of how they address passengers, and how they carry out their operations to ensure safety. Okay, so we train and increase awareness of gender issues across staff and decision makers. Under the intervention of infrastructure and surveillance, we identified gaps in the infrastructure designs and bus stations. Some of our infrastructure designs and bus stations, particularly the Ojota bus terminal, where we had identified some dark areas. So we needed to introduce more CCTVs and also lightnings in these areas. And another thing we identified was the restroom, having to separate the gents from the ladies and not having them, in close proximity to each other, because we, based on our surveys, realized that a lot of harassment or insecurity, could happen within the space of 2 minutes. So we have redesigned our bus stations, introducing the safety measures. Okay, so we also have a new design brief interchange design, which we are also implementing. And this is, as part of our other project under HVT, the TREAD. And then we have gender dimension and women's safety. We have introduced the gender and equality policy within Lamata, and we are ensuring that we carry this through, on all our bus terminals and our relations with our bus operating companies. So we have more surveillance at ticket queues, because we realize that people queue even at night, in the evenings, to get their tickets. So we have more surveillance, introduction of physical and digital security, as well as increased lightning. So the picture there is Ikeja bus terminal, and the other one is the station at Mile 2. So measures delivered, which we have delivered with the SheCan tool as a guide. These are the measures we have delivered. We have a robust passenger and stakeholder data collected. We have introduced or included into our periodic customer service survey that we do questions around sexual harassment. We want to know the feedback. We want to have the feedback of passengers when they use public transport. So we're not just about comfort and all of that. We're about, what have you seen? What can we introduce? What are the measures? Like somebody mentioned about having to introduce or to get feedback via apps. We have feedback from that as well. We're looking into incorporating it into the apps that we have at the moment. So we are reviewing the design of our new bus terminals and depots to ensure that they are safer, and increasing the number of stakeholder forums that we have with operators, speaking about sexual harassment and prevention. And I've spoken about improving our quarterly customer satisfaction surveys to document sexual harassment and feedback from customers. So we are also promoting a more diverse workshop, and another thing that we are doing is priority sitting and boarding for persons with children, pregnant women, and the elderly. Sometimes you find that, especially during peak periods, the rush is really high, and most times people tend to ignore people with pregnant women, people with children, and all of that. So we're having to ensure, that we give priority to them first, when they are boarding. Other things we are doing is to deploy emergency and panic buttons on public transport stations and vehicles. We are at the moment in collaboration with the Lagos State Ministry of Science and Technology to introduce or to deploy about 2,000 CCTVs across the corridors, the bus stations, and bus terminals within Lagos. So that's part of what we are doing. And then increase campaigns, speak up campaigns, have more short videos that we can share on social media and also on YouTube. Okay, so that in a nutshell is what we're doing. Thank you. Thank you.
Thanks, Jane. Maybe any one quick question before we move on?
Yes.
The gentleman hasn't spoken yet.
Thank you. I'm not sure. That's the first point, but
Okay.
do you have any idea how successful your interventions are?
Well,
Repeat the question, please.
okay. So do I have any idea how successful our interventions are? I would say they are very successful. I don't know if I can place a percentage to it, but what I can say is that they have worked for us, as a transport agency. They have helped us to look at our designs, because the whole idea for us is not just to provide public transport infrastructure, but then we want to provide something that is safe for use, something that is sustainable, and inclusive, like someone said. So it has worked for us.
Continue that
Okay.
during the Q&A. Thank you, Cheyenne.
All right. Thank you.
Move on to Ethiopia now, and Bethlehem Hadas from Addis Ababa Transport Bureau. If you'd like to join us up at the Bethlehem Bernard will sort you out.
If you go through, you'll just go down for the next slide.
Okay, thank you so much and nice to meet you all. Just to introduce myself, I am Bethlehem. I came from Ethiopia and from the city of Addis, and I'm mainly working on the city administration transport bureau, working on pedestrian and cycle infrastructure, focusing on that. But this idea came to us because we are also from the local authority. We are giving that service. That's why, and thank you again. So just to introduce my organization, which is the City Transport Bureau, we have a great vision, which is making for our society to have a reliable, safe, efficient, and environmental friendly urban transport system, which is the great vision of the city administration, with pointing also those missions. So just to show up also how our organization is structured, we have the head, which is a bureau head, having three main sectors under it, which is the first one focused on the infrastructure development sector. The other one is the working on the operation part. Then finally, the one which is the study and technology sector is these are the main organizational structure, how our organization works. So based on that, there are different study teams which are working in each sectors. So just for our city, we have this type of modes of transports, which are the major ones. So walking is the one, the other is taxi. We have also light rail transport in the city, plus the public transports, which is also buses and other private public transports are there. Cyclists are also the other modes of transports we have in our city. Then those three-wheelers, which is we call them bajads, are also there, plus motor vehicles are the main major modes of transports in our city. So when we come to our topic, which is in terms of Empower and GBV activities, what are the main initiatives we have done so far is mainly the city developed its own prevention and response implementation action plan based on this gender-based violence. So we have this document, which is implemented and distributed to those selected stakeholders. Also, we have developed these national strategies, which are mainly aiming on these GBV activities. The other one, which is with the support of different non-governmental organizations, the Ethiopian Women Lawyer Association are working on these awareness activities, campaigns with different advocate groups. So these are the main things. We are working purposely under these topics. Then others are also those social medias who are working to spread this awareness. So related to that, just to point how our GBV prevention and response implementation action plans contains. So it is launched on this 2060. It's a World Bank financed project under the Transip, which is the project implementation unit, which is under in our bureau. It is. So this is the one activity we have done in our bureau with the help of the financial from World Bank. So this focused on this assessing of this GBV action plans. What are the main risks on this transport?
Screen.
Okay, thank you. So this action plan is mainly focused on this, how the risks are there in those road infrastructures, the facilities, and those service areas. So incorporating in each projects, this gender-based violence activities is the main thing. It is focused on them. So the aim is also related to accelerating those things through those facilities. So the key actions, it has its own key actions, implementing agencies, and finally, what are the outcomes from the implementation plans, the action plans incorporate by this way. So those key actions and recommendations that are pointed under this document is like to build the capacity of those individual staff, which is one thing. So related to that, the executed during GBV days, activities related to that, and applying these things on those projects which are under these projects are done. So a lot of trainings of individuals who are working on that, those experts are be capacitated under this capacity building activity. The other one, which is institutionalizing of this gender-based violence for those stakeholders and making some study units and focal persons on those organizations is also the other activity. As per that also, this is assigning of those adequate and capable experts under those units are also be done. The other one, which is put in place those women-friendly transport facilities, road transport infrastructure, and public transport services. In terms of this also, there are things that are done around 10 facilities in buses, walkways, parking areas are being done and implemented. Plus strengthening of this GBV prevention and response in road and transport sectors are also the other point, which is applicable during this action plan. Are the main things, just to introduce you what are the main and key actions which is done so far. So related to the SHICAN tool, we are one of the, from the 10 African cities, which is because of our public transport service, and that's why we are selected, and we are great for that. So related to this Empower 2 project, we have done such actions because as per the activities which are pointed, mapping of around 9 stakeholders are mapped and selected by these activities. Then we delivered the survey by interpret it to our local language, which is Amharic. It is delivered for them. Then we received those results of surveys from them based on their focal persons. Finally, we have done a workshop on to get their findings, to go forward and to indicate the next steps. So just these are the main focused stakeholders from the governmental bodies plus the private operators which are working on this transport system. So just to list out, these are the list of stakeholders at ministry level, at city level. We have transport and logistics authority, plus at ministry and city level also we have women and social affairs office are also there, justice office is there also. The city traffic management authority is the another one. Police commission is the one who is recording this activity, so they are also be there. Then the light rail transport service company, the city bus service company, and the private bus operators those are the main 9 stakeholders we have done with our surveys. So during the survey, these are the main focusing points we requested them to incorporate under the survey. So based on these activities, we have gathered some major findings. So these are the main findings we have got during from our surveys. So at the city level, we have such policies and strategies which are preventing this gender-based violence are applied at city level. There are various laws also be there related to these topics from different organizations. This is their response also. There is also partnership with local law enforcement to improve this passenger safety and guarantee activities are also be there. And also there are main points which are to provide a secure and safe transport service for women. Research have been done also at the city transport by Ministry of Transport and Logistics, and so on are the main findings we have got from the survey. In addition to these activities we have done. So what are the next steps? We have got also their concerns or the things they came from the workshop. So these are the main things they are raised during the workshop. So the first one is, if we are applying this SHICAN tool, for example, is that adoption and implementation will become institutionalized by involving the relevant parties. This is their recommendation and even questions from them. The other one, which is for further collaboration of these things, we have to work. The leadership activity will be taken by the City Transport Bureau, but by considering these points, like we have to make sure of incorporating of this transport sector in the recently enacted anti-GBV policy. This is the one point. In terms of device, also prevention mechanisms through public transport operators, how it is done and operated. This is the other point. Then also they have related to activities, how the public transport operators ordered this tool in our context. These are, and the others are the main things we have done so far through the workshop. So by this way, we finalized our workshops, and these are the main things we have to done for continuity of these activities, which is what we have got from them. So this is just to show how we gather from those stakeholders, from the 9 stakeholders. These are the focal points, and we have done the workshop by this way. So this is the final one, which is from Addis. Thank you so much.
Thanks, Betsy. I've got one follow-up comment, maybe. Good thought. That's really interesting because it shows that we were talking about stakeholder roles and responsibilities all morning, really, and your role, it seems, is quite strategic level, setting policy, in this case, the anti-gender-based violence policy. So that sort of sets the framework now for the transport service providers to follow, I suppose. So is the challenge now to try and facilitate the transport providers in adopting some of the anti-GBV policies? Is that right? Mm-hmm. Mm-hmm.
There is no mechanism or methodology. Rather, most make us from them by this way.
Yeah.
So maybe this tool is one easy method. This activities related to that.
Lovely, thanks. So I mean, for those online, it's finding ways to monitor the progress that the transport providers are making with regard to anti-GBV policies. That's really interesting. Thanks. Time for one quick question before we move on. If not, we'll keep the momentum going. Thanks again. Need to find myself. Who's next on the agenda? Oh, I think it's me. Oh, that's it.
Did you get anything from Fatima?
Yes, I've got Fatima's slides. So Fatima Adamu works for Nana Women and Girls Empowerment Initiative, an NGO in Nigeria. She's been a really great partner in both Empower projects. She sadly can't make it today. She was very disappointed that she couldn't make it. I'm going to do my best to present her slides. There's just a couple, but the interesting angle here is really looking at the informal public transport sector, which is something which she's been looking at. And hang on, if I come backwards. I can't cope with Apple products. That looks good. It's like a whole different language. So Nana's been active for many years on ways to tackle gender-based violence, particularly at school and community levels. They haven't gone into transport until this project, and so they've been making some good inroads here, and the sort of knowledge from the project has helped them go into that sector. And there's two initiatives that they're delivering, and the first one's really about the education element. So Fatima and her team have engaged with 20 schools, many thousand students, in educating teenage girls at school and younger girls about reporting, how to go about reporting incidences. So that there is anecdotal evidence of there being incidences as they travel to and from school. And the big challenge is that the only transport in this particular part of the country is informal, and particularly bike taxis. And so the campaign in school is how to spot and respond confidently to these occurrences, and it means that they're confident enough to do so, and that in itself helps to report, to gather data so that action can be taken. So they're doing a lot of work around that. And then another one is engaging with the transport unions that are responsible for managing the bus and bike stations. And I think this month actually, Fatima is leading a workshop with a couple of the unions to try and develop a new policy on gender and safeguarding guarding for drivers in particular. And again, that's on around the education side of things. But yeah, it shows again that the informal public transport sector is absolutely key. And for doing the stakeholder mapping process again, the route in, the angle to influence is believed to be through the transport unions, and that's the approach there. And I probably didn't do that justice, but that's the best I could do with her slides. So she sends her regards, and I think I might still be here for the next one. Is there a 5.1? No. Is it 6 next? Okay, fine. Then next up, I believe, is Lucy from the Flown Initiative in Kenya. So,
you go through it, you're just going to press down or side arrow.
Oh, okay. Thank you so much. Good morning, everyone. Is it still morning? Okay. Thank you. So once again, my name is Lucy. I'm from Flown Initiative based in Kenya. I'm currently assisting with the implementation of projects and programs within the organization. So Just to highlight about who is Flown Initiative, we are an NGO that focuses on gender and disability mainstreaming in public transport. And we've been in existence for 10 years now. We are celebrating our 10th birthday this year. Our main vision is a public transport system where everybody have all freedoms of mobility. So looking at women, persons with disabilities, and older persons. This is some of our programs. We have 6 programs. Women in Transport that seeks to attract, retain, and advancing women working in the transport industry. Usalama wa Umma program that looks at gender mainstreaming in the public transport sector. The Moving Barriers program that looks at disability mainstreaming and actually elevating the voices of persons with disabilities as right holders of accessible transport. We have research that focuses on bridging the data gap since there's minimal data on issues of gender and disability in public transport. The other program is a Report It, Stop It program, and this is a tool that we've been using to actually gather data on sexual gender-based violence in public transport, and as well as providing a platform for survivors to actually get support. And lastly is the Women in Transport Africa Conference, and this is a program that this is a conference that happens each and every year, and this year it's happening between the 4th and 6th of December, and everybody is invited. I don't know whether I should say that in this forum. Yes, so it brings together policymakers, academia, we have public transport agencies, we have different stakeholders working in the transport sector. So some of the issues that we are addressing as Flown Initiative, and these are the main issues that affect the public transport sector in Kenya is, of course, lack of data. The other thing is social norms. I've said we work in the space of disability and gender mainstreaming. So looking at exclusion of women in the public transport workforce, looking at inaccessibility in public transport and how persons with disability are actually perceived as they use public transport. The other thing is gaps in policies, and this is because 100% of our public transport, and especially road transport in Kenya, is informal. So the government haven't developed proper policies that address social issues, and the ones that are there majorly address infrastructure and physical infrastructure within the country. And then the other thing is uncoordinated and fragmented interventions. You realize in Kenya we have national government and county governments. So you find the national government is doing something else, and then the county government is doing something else. So having that cohesion in working together, it's actually a huge barrier. And then the last thing is lack of political goodwill, and especially on social issues, looking at women, and again, looking at the public transport sector being male dominated. So most of the social issues that affect women and the most vulnerable in the society are not actually budgeted for, and especially at the government level. And this is something that we've been trying to lobby for. So as we were coming into the project, we had conducted a research on violence against women and girls, looking at Nairobi, and this is data that's dated back in 2019, thereabout. And looking at transport system in Kenya, about 10% of the public transport workforce is comprised of women. So you can see 90% is men. Looking at prevalence to sexual gender-based violence, about 76% of workers who work in the industry have either experienced or witnessed sexual gender-based violence. And about 88% of the commuters have, again, experienced or witnessed. And digging deeper into these, the main perpetrators are male public transport operators. And I can remember Lydia was saying, how do we involve men or potential perpetrators into this conversation? So looking at it, and based again on the SHICAN tool and the emphasis to actually dig deeper and engage more stakeholders, most likely as you actually roll out the SHICAN tool and sensitize people, most of the people that you'll meet are men. And that means you kill two birds with one stone, because again, they'll be more aware and they'll actually implement the tool. So looking at the 2 entry points to the SHICAN tool, getting knowledge and making decisions. So for us, we had three interventions, priority interventions. The first one was on legal frameworks, surveillance and policing, and the last one was campaign education and behavior. But we majorly focused on the last one, that is campaigns, education, and behavior. But again, something we realized is that these three components are intertwined. For example, if you do advocacy, then at the end of the day, we might influence policies. And then if we influence policies, then the legal structures and systems will be strengthened. So for us, we were able to utilize the data collection template that it's contained in the SHICAN tool. And through the data collection that helped us do the industry assessment. And in this regard, we worked with a SACCO called Embasava, and ASACO is a public transport service provider. So they offer transport services. So we were able to understand where they are at, the challenges they are facing, the opportunities, the strengths and the weaknesses, so that we could roll out the program. And then we also utilized the stakeholders mapping tool. Again, we had an option of involving government, we had an option of involving local authorities, we had an option of even involving other NGOs. But again, based on our expertise and good relationships we've been having with public transport service providers, we opted to work with one company that offers the services. And then also through the tool that, the SHICAN tool, we're able to do what we call interventions prioritization. And again, looking at advocacy work, there's so much that we could do. But again, we thought of advocacy and looking at public sensitizing the SACCO and also members of the public. And then the other thing we looked at was the case studies and looking at what has worked in other countries and what we can do and how we can leverage on that. So to us, the key thing that we were looking for as we were deploying the tool was investing in low-cost interventions that have high impact, and also looking at the time frame of the project. We're also looking at a project that we will implement and actually be within the time frame and actually get the best results. And then the other thing, we're looking at a project that will increase impact and at the same time promote the safety of women. And then also we're looking at scalability. So if we deploy one component of the SHICAN tool, how do we upscale from where we are to the next level? So just a brief background about the transport company that we involved. That's Embasava SACCO. It has about 500 public transport vehicles with about 1,500 operators. And these are among the leading companies in Kenya that's transitioning to green energy. And it's ranked among the leading SACCOs in Kenya. So I've mentioned before we rolled out the program, we needed to do a baseline. And again, there was a tool that it's contained, the SHICAN tool. So we used that to assess the situation of the SACCO and the structures available to tackle sexual harassment. From there, we trained the board of management because we felt we needed to attack it from the decision makers' point of view. Because if we target the operators, the knowledge might not actually trickle down. But with the board of management of the company, we were sure that we will be able to influence policies at the company. And looking at how the system is structured in Kenya, they don't have any governing policy. And again, looking at social issues affecting the most vulnerable. So after the baseline, we trained them on the SHICAN tool. And after that, one of the recommendations from the workshop was advocacy campaign against sexual and gender-based violence together with the SACCO. So we partnered with the SACCO to roll out the advocacy campaign. Again, based on the assessment that we did, a lot of issues came up. And looking at what we have on the screen right now is that there's inadequate understanding of sexual harassment. And actually this led us to tailor-make our training, highlighting the different forms of sexual harassment. And again, these are components that are found in the SHICAN tool. And then we were able to highlight on available sexual SGBV referral pathways. And again, we tailor-made it such that it's within and it speaks to Kenyan law. And then the other thing we looked at is the available ways that the SACCO can do to ensure that sexual gender-based violence is addressed in public transport. So the other thing we realized during the baseline was lack of policies to address sexual harassment. And again, this maybe this will form part of our part 2 implementation is the government doesn't recognize sexual gender-based violence in its policy. So they only recognize sexual harassment in formal employment. So you see in an informal working space, you are not protected and you're not guaranteed that you will be supported whenever you fall victim. The other thing is gaps in existing policies, and also lack of clear sexual harassment referral pathway, and again within the company, because many other times that sexual harassment has been attributed to being a gender issue, which shouldn't be the case. This is a criminal offense. But again, since that industry is male dominated, people feel this is not happening, you know. So so when you talk about sexual harassment, they say this is a women issue. We don't have to have such structures here. But again, that was demystified during the workshop. And then there's also lack of training among the operators on sexual harassment. They really don't know. And looking at informal sector, sometimes sexual harassment is confused to customer service, because sometimes you have to be ushered into a vehicle, someone touching you, directing you to a vehicle, but they don't know that that's harassment in the first place. And then they also lacked data on prevalence to sexual harassment, because again, they are reporting channels. They only focus on general complaints and they don't pay attention on incidences of sexual harassment. So from the training that we had with the SACCO, of course, there was increased awareness on different forms of sexual gender-based violence. We were also more aware on available referral pathways, and also we trained them on the laws addressing sexual harassment within Kenya. And after that, they made commitments to strengthen their reporting mechanism. Again, I've talked about how the SACCO was more focused on general complaints. Like if you haven't been given your change, your balance, if you have been dropped at the wrong place, those are the complaints that they were handling, and less on sexual harassment, because I don't know whether they assumed or they thought it's not happening. And then the other thing that they are looking forward to doing is train staff on sexual harassment, because majority of them do not actually understand sexual harassment. The other thing that they committed to was engaging advocacy campaign against SGBV. And lastly is publicizing the tool in their buses. Moving further, so we again received some small funding to roll out the advocacy campaign. And what we did in collaboration with the SACCO is that we had an inception meeting with them, again, trying to see other practical ways on how to make the advocacy campaign successful. So we realized they had other structures existing to address complaints, but again, as mentioned, no proper ways of documenting and addressing sexual harassment. So they had an OB book. So they advised that we strengthen it so that it could capture incidences of harassment. And then the other thing, they didn't have a proper way of publicizing their mobile number where people could report. And then they also proposed that we distribute matatu stickers with advocacy messages highlighting different forms of harassment where the survivors can report, and also the existing laws. And lastly, of course, we designed advocacy banners, and these banners will always be mounted whenever they are having activities, and they can actually create more awareness. So these are some of the stickers that we designed together with the Board of Management, and they were put in the matatus. And you can see from the first poster, maybe you can use the one that has English. I don't have a pointer, this one. So it says, do not take a shower if raped or sodomized, go to the hospital immediately and report to the police. And you can see here, there is a phone number where a survivor can call. And here there is a QR code to the SHICAN tool. So even if you're not a survivor or victim, you can be able to scan this and maybe read through. You could be a decision, you could be a government agency, you could be a researcher, you can scan here while on transit in the matatu and access the Shikan tool and get more information about it. So we also updated the incidents occurrence book. And this is a book that they were using to document complaints from the commuters. So initially, it was only capturing an incident, time, and location. But now we improved it to include components of like going deeper, and I'm not able to zoom, but I wish I could. We improved it to include components of what support they are offering to marginalized and vulnerable groups, and especially this was meant to capture the different support they're offering to women, persons with disabilities, children, and older persons. And again, the OB book has a link to where they can report. It has a hotline, 1195. That's a national hotline where survivors can be able to report. And lastly, it also have a procedure. If they are not able to handle an incident at the circle level, where else can they refer that incident? So additionally, the OB book also has an SGBV referral pathway, because in most cases, whenever someone is assaulted in public transport, they don't know where to start. And some people actually maybe run to the police first, but the referral pathway shows the operators. For example, if somebody is sexually harassed, they're supposed to run to the hospital and then to the police. So it has a clear pathway. And among the last things here, it has a QR code on where somebody can actually access the Shikan tool whenever they want to. And we also designed these posters, this banner that will go to their notice board, and they'll be using it during workshops and events. And it will also be used whenever they are rolling out any advocacy campaigns. And here it has a QR code again to the Shikan tool so that everybody can be able to access the information. So some of the opportunities that we picked from the whole engagement. The first one was on strengthening the circle structures to address sexual harassment. And again, this is contained in the Shikan tool. So in the next steps, we hope to again work with the circle to develop a sexual harassment policy, because sometimes we might do advocacy, but without a binding document, it might be difficult for people to actually adhere to whatever is being said. And then the other thing is the customer service charter. And this one, it will provide an opportunity for commuters and especially marginalized and vulnerable, looking at women, persons with disabilities, and older persons. They can share their feedback. And in most cases, the feedback we hope to expect is on harassment, because it's a huge thing in Kenya, and especially in public transport. And the other thing is a code of conduct for transport companies to have a code of conduct. And again, this one was a recommendation from the circle that we are working with. So we hope again to support in that. The other thing is awareness creation on sexual harassment in public transport. And as you are engaging the board, because there were only 10 members, they proposed that their whole public transport crew be trained on sexual harassment. And lastly is advocacy. And we've already started on that. And the other thing that we hope to do, because we are using this one circle as a pilot, is in the future to lobby for policy reforms at the national and county level, because as we speak right now, harassment in the informal sector, and looking at one of the laws in Kenya called the Employment Act, where there is a requirement, if you have more than 20 employees, you need to have a sexual harassment policy. But now this is informal sector. So you are not engaged either in a contract, you just show up to work and you get to learn on the job. So what we are hoping to do is try to lobby for amendments in the law and seal the gray areas that are existing within the policy, so that even people in the informal working sector are recognized and actually protected by law. So that's it from us, and thank you so much for listening.
Thank you so much, Lucy. Everybody will have lots of questions after that, I'm sure, but please keep them in your head for the Q&A shortly. That was fascinating to see how an NGO and a public transport provider can work together successfully, and congratulations, Lucy, and your team on all the work you've done there. I noted down an opportunity, Mariana. You might have seen Mariana's been very busy on her feet all this time, making notes of barriers and opportunities, and we'll talk about that in a second. But one opportunity perhaps, and a question that you raised earlier is linked to that, that there are in place systems to capture transport users' general complaints, but there is no question at the moment in that form to include anything about GBV. So maybe an opportunity is to use a system that already exists, but add to it, and maybe to add a question to that. And that struck me as a good opportunity. Anyway, we're going to keep moving. And where's Thomas? So we're over to Thomas Mayuba from the Zambian Road Safety Trust now. He's our last speaker, and then we'll open it up to a discussion afterwards. Thank you.
Thank you. To scroll through, just press those.
Thank you. Good morning, everyone. So it's an honor to be part of this discussion or this seminar. I'm from Zambia. I'm a research officer at Zambia Road Safety Trust, an NGO. And so I just want to briefly talk about the Shiken2 and how it has helped us also in trying to conduct different activities. We recently joined the Empower project this year, somewhere in February, but we've had so much impact from it also in our community, and also looking at the area of sexual harassment in public transport. To begin with, I just want to highlight that really sexual harassment is a problem that hasn't been talked about. When you come to Zambia, even in many other African countries, it's something that we know about, but we don't really talk about it. And not until it was also introduced to me, I think I was also silent, just to mention that, Paul. Until I was introduced to the Empower project areas, that this is actually a problem. Okay, sexual harassment, harassment in public transport is a persistent problem, and it undermines the safety and dignity of passengers. Every day, people in Zambia, especially women, face unwanted advances during their commute, which violates their basic rights and creates an atmosphere of fear. One day, just last week, I was heading to work. I just turned like seeing my office like maybe just a few meters away. There were these men who were pushing a bus which was broken down. Okay. All of a sudden, there was this lady who was passing, and she was going to get on another bus. They quickly started throwing different comments at her, like, so in my local language, I'll interpret what they're saying. So it's saying matako, this, and some even started singing. There's a song in my home country, which goes like matako, matako. So now to interpret that means like buttocks, buttocks. And so such things happen almost every day, because I get on public transport almost every day going to work. So I hear that, I see that almost every day. And sometimes maybe there's even a police station nearby and someone is behaving like that, but the police don't do anything about it. So this issue keeps going on, but it remains underreported and also not addressed. Okay, so now talking about the Shiken2, when we were introduced to the Empower project, we made sure we leveraged the Shiken2. So we started doing the stakeholder mapping, and from there we started doing we did the stakeholder workshop, and recently we just completed doing a passengers survey where we did a survey from about 1,200 respondents. We had overwhelming response from that. we also did some focus group discussions, and you'd realize that as you were conducting the passenger survey, the focus group discussions, there were many things which are coming out, such that even as you are conducting the survey, you'd want like to go on and keep asking questions to understand the problem further. And so those are some of the results from the survey, which helps us to identify the scope of the issue. And when we ask certain questions concerning those who experience sexual harassment and those who also witnessed, you see that there was 86% of those who experienced sexual harassment in public transport. And in terms of witnessing, it was about 97%. Briefly about us, Zambia Road Safety Trust is one of the leading organizations dedicated to building safer and more sustainable transportation system in Zambia. We are driven by profound concern for the lost lives and injuries sustained due to preventable road accidents and disproportionately impacting vulnerable groups like pedestrians, cyclists, and also school children. So our vision is mainly to see that every Zambian, every journey is safe, sustainable, and accessible to all. Our mission is to reduce road accidents and fatalities through education, advocacy, and infrastructure improvements. Okay, and so I just continue with some of the outputs that we got from the survey. When you look at the different types of sexual harassments that happen on these road networks, we discovered that intimidation by groups was like one of the highest that was witnessed. And this is so because in my home country, there's what we call junkies. Maybe some of you have heard of that term, say junkies. The junkies are simply these boys who like taking drugs, alcohol, and maybe who lost employment, they're not employed, and so they would want to stick around bus stations. They would want to stick around bus stations, and so even when passengers are about to board, they come close to help to show to the conductor or the driver like they are helping to bring them near, so they get some money of some kind. And so even when they come like that, sometimes maybe they are drunk, maybe they are high, and so they do all kinds of things. And so that's why you find that issues of sexual harassment on public transport is very high. And one of the other common type of sexual harassment we discovered, which was experienced by most of the respondents, is verbal abuse. And this one we also discovered it like what Lucy was saying. We also did a baseline survey before we did the actual survey. We just wanted to test the two and see the certain percentages for sexual harassment in public transport, and verbal abuse kept coming more in that baseline, and here we're able to see that it's one of the highest in terms of those who experience the kind of sexual harassment. Then in terms of prevalence and frequency of sexual harassment in public transport, the survey reviewed that mostly it happens in vehicles, followed by like when the passengers are walking from home, like maybe wanting to get on the public transport, and also on their walk to their destinations that they may be going. And it's more prevalent in terms of the frequency. It happens almost every week. For every respondent that we interviewed, they indicated to say it happens almost every week. But for me, who uses public transport almost every day in the week, I see it every day. I witness it every day because I connect to about, I think, three cars. So there's no route that I haven't witnessed it. Almost every day it happens. And so for the respondents, these are some of the top 5 helpful solutions or measures that they said would need to be improved for us to change the narrative about sexual harassment in public transport in Zambia. And so they emphasize on education and awareness programs. And when you look at the Shiken 2, you have those interventions which talk about that also. Increased security presence, clear reporting mechanisms, bystander intervention training, and strict enforcement of policies. So that is some of the pictorial highlights of the survey that we had for the passenger survey. You can see on my left. I think we should be on your left, on your right from that side. One of the data collectors was trying to chase the respondent even after they get them from the bus station. Because what we did is we conducted the passenger survey from 6 bus stations, main bus stations in Zambia, in Lusaka, the capital city of Zambia. Then we also, these are some of the pictorial highlights of the stakeholder workshop that we had. And so we hosted different kinds of stakeholders just to be able to discuss it in detail. And something interesting that was discovered is what we call, so before we had what was called Ministry of Gender, but now it was scrapped off. We have what is called now Gender Division, but it's as big as Ministry of Gender anyway. It's called Gender Division. And they indicated to say, this is something we've never thought about before. But they agreed to say, actually, we see this also every day. Now that you've mentioned it, we'll make sure we as a ministry, we make sure we'll take it up. And they also said that in terms of issues of law regarding sexual harassment, there's nothing clear about that, honestly, when it comes to talking about sexual harassment in public transport. Maybe there is on sexual harassment talking about defilement, rape, but not really specifically to talk about sexual harassment in public transport. Okay, so some of the key challenges and barriers, we have fragmented responsibility, clear roles. Clear roles and responsibilities are vital for effective prevention and response. Each stakeholder must play a defined role. So there's fragmented responsibility. There's no department which says, okay, they're looking at sexual harassment in public transport. And so from the workshop, we discussed, so we need to come together. Departments need to unite. If it's ministries to unite, who will be doing what, and how can we harmonize activities that will help to curb sexual harassment in public transport. Then we have issues of cultural and religious factors, and also legal and evidential issues. There are no clear laws or penal codes that clearly talk about sexual harassment in public transport. Lack of awareness and training. So most people actually get surprised. Oh, this is actually sexual harassment. They get surprised. Okay, and so we really need to do serious awareness and sensitization in these communities. And from the workshop, we agreed, even as a team, and we even formed a WhatsApp group. We said we'll make sure we carry out a campaign on social media platforms and different platforms. Just make sure we bring about awareness about this problem, which is not being talked about in Zambia, and yet it has been in existence. Then also there's inadequate reporting and mechanisms. There's no data. When we were having the workshop, I tried to ask certain key stakeholders who I thought would have the data. I said, is there any statistics about sexual harassment? They said, literally, we don't have anything. We'd actually get data from you. And so now you see the importance of the Shiken 2 and even the survey that we conducted. It's something which almost every stakeholder is actually asking for it. And so next week or 2 weeks from now, we are planning to present the passenger survey to these stakeholders. And then the other one is retaliation and fear of reporting. This issue, when it happens, when the victims take the issue to the police will say, where's the evidence? Okay, or if they don't say where's the evidence, what they'll say is, that's not a big issue. That's not a big, just ignore that. That's not a big issue. So some of the victims have said that, those who are interviewed, and funny enough, even those who are interviewing, they've experienced that. And while we're conducting the survey, that some of the cases were happening while we're conducting, so some of the data collectors, because we had more of the female data collectors, so they would stand in differences. Some of them would actually be sexually harassed, even while they're trying to interview. And there was an incident where one proved and said, so what are you going to do? I've touched your breast. You see, because once they take it to the police, no evidence, no CCTV cameras. That's why even when we're doing some of the focus group, the respondents were coming out to say we need to have CCTV cameras, so that at least even when I say it, to say this one touched me, it will be able to show on the cameras. So lastly, as I'm trying to conclude, leveraging on the resources for impact, we agreed to say the Shiken 2 would need to harness the power of the Shiken 2 to educate and empower individuals to prevent and respond to sexual harassment. And so when you look at all those interventions, in other countries, some of these things have already been experienced. Okay, and they develop certain interventions which worked in those countries, and those are some of the things that we were discussing with the stakeholders to say we can also try, maybe it can also assist us to solve this problem of sexual harassment. Then pulling resources together, we agreed to say we can also look at ways how we can also look for resources to just increase also the scalability of fighting against the issue of sexual harassment in public transport. Policy integration, trying to make sure we integrate some of these policies in different institutions and all. Raising awareness and fostering change. So targeted sensitization campaigns rather. I think I mentioned more on this. So there's a radio station we're in touch with. So they've given us about 10 minutes free slots, so you can talk about this issue. So 10 minutes. So this is one of the achievements that we have. And then also policy brief development. So we said, since there's no clear guideline on issues of sexual harassment, we agreed as in the stakeholder workshop, so we need to develop a policy brief. And this is something that we're about to complete by the end of October. We want to submit to Ministry of Transport and Logistics, because they invited us to say, please, if you have anything that you want us to add in the national policy, just bring that. And so we are finalizing the policy brief end of October. Then in Zambia, there's something that we call 16 days of gender-based activism, which happens in November. So through those discussions that we had in the stakeholder workshop, they said they would give us a slot of 3 days, even as stakeholders, where we're just going to talk about sexual harassment in public transport. So among those 16 days, at least they'll give us 3 days just rolling out talking about sexual harassment in public transport. And then, of course, continuous evaluation and engagement. So we said we need to keep each other accountable, even to what we agreed in the workshop. We said at least we need to be checking progress quarterly. Say what we agreed, how far have we gone, what have we achieved, are we moving in the right direction, or we are stagnating? Thank you so much. That was fantastic.
Thanks, Thomas. Wow, congratulations. That's a really good piece of work.
Thank you.
And it already looks like it's going to lead to more activities as a result. And your data is now in demand by lots of different stakeholders. And that's really impressive to hear. Okay, so we've had our presentations. I do want to bring in some questions that you might still have for any of the speakers. And then we've got, including Thomas, and then we've got a little exercise that Marianne is going to introduce us to. But anybody, first of all, got any questions for Thomas or any of the other speakers? But I didn't allow you the time to ask them previously. Do you mean the tool itself?
No.
Do you mean with the tool? Or is there a case study? Yeah, no. So the tool itself is a information repository, and there's no links to other organizations.
Can I react? So the question is, can there be a direct feedback loop to stakeholders that are responsible when there is information around sexual harassment? The problem for us as developers is that this is an African-wide tool. So we would have to have, all the police stakeholders, et cetera, in the tool. At the moment, that is, one bridge too far. I do think that there are opportunities where this tool is a base, and then there is a local add-on. If a certain municipality or country is really interested in that, then you could develop a kind of an additional module that utilizes this information and then works with the local stakeholders. But at the moment it's too wide for us. One bridge too far. I think we need to go to that side of
Cool.
Mali as well.
We're going to start at the back. Sorry, Lucy. I'll come. Okay, Lucy, you go because you can respond. Sorry, 2 seconds. Okay.
So I'm saying, so for us in Kenya, and especially we as Flown Initiative, what we are trying to do, and this is going forward, the next steps is we are looking forward to relaunching a web-based platform called Report It, Stop It. So it has it's a platform where survivors can report incidences of harassment as they happen in public transport. And also there's an option for them to access more resources. It could be police contacts, hospital contacts, and also, for example, ambulance, and also be able to access more information on identifying different forms of harassment. And I was just talking to Paul and telling him that we hope that the SHICAN tool can be part of the platform, and so that more people can access information and can know where to report. And something else I mentioned during my presentation is we have a national hotline where survivors and victims of SGB do report. So they are able to access psychosocial support from it's a free, toll-free.
Who manages the national hotline?
Yeah, it's managed by a hospital that's actually supported by the national government.
Okay.
Yeah.
That's interesting.
Thanks, Lucy.
Thanks, Lucy. And yes, at the back.
And in ground the data, the president launching the National Security Plan on GBVF. Obviously, it's one of the global goals that we work into that. I'm trying to align this process with that, if it was or not, it's separately, but we see it. However, I saw it on the priorities or the pillars identified by the president as pillar 6. I saw this particular pillar 6. From the Department of Transport side, we put into pillar 2. So, which is awareness to create reduction in and the pillar 6 was actually information and management thereof. So I was trying to align this and I couldn't find it. But after Lucy's presentation, and I think the question that came from here, I saw it, and what you confirmed was that this tool was basically giving you a baseline, and you have to start somewhere because we had no way to start. And then obviously a development of another system So for me, my mind was thinking, there's a lot of work went into the development of this to give you a baseline. What about configuration where in the current year, all of this is logged in, and then all the key role players, like law enforcement, are brought into it. It's just a thought. It's just my thoughts. But I was sitting a little bit confused in the beginning, and then it started to shape itself. So I still have a lot more, but I don't want to take up time with the consumer English bit. But I would do one-on-one engagement because I have to now from a transport side, and especially public transport in South Africa, deal with this. And we've already started our own coordinating committee. We just got approval and we will be meeting. And I think there are stakeholders that we need to bring into this. And I just want to say thank you and appreciate it.
Thank you for that. For people online, it's have we aligned a tool to Department of Transport and parliamentary processes that are going on as well? No, we haven't. When this was starting, it was really from scratch trying to get that baseline, and that's a very good conclusion that you are coming to. In the recent past, so while we are working on Empower 2, I had 2 attempts to get stakeholders in the room. I think it was partially the wrong time, maybe not talking to the right people, etc., school holidays and those type of things. So at the time, it didn't transpire. The interest was too small. So I love to work one-on-one with you, and we're having later in the month, Department of Transport discussions about other things as well. So I think it needs to be brought in there, and then we can take it forward of really how to get this launched properly in the South African context as well. Thank you for that. I think it's Marley's time and then John.
Labels. You can then think around more from an empathetic side of how to do something, because often we all can't go to the community. That is my biggest point that I do need to, but it at least starts in making people who are designing a little bit more empathetic towards something, to what they're doing. And then what we've done then with that is, apart from the very good quantitative surveys that we have, we've also done qualitative surveys, similar to the Intersect stuff, but we used a design thinking sort of process. So it was very different than a normal Intersect survey. And there was somebody taking a video and just observing people, and there was somebody drawing what the people told us what's happening. And just the richness of the stories that came out of that are extremely powerful to think about project design. Then just a quick second point. I think, especially in our community context, we've got such strong sort of forums in our community already. We're thinking about ECD forums in Langa or Palicha or whatever, as well as the community kit that was established during COVID. And if we as officials can get to a point where we go to those places and listen to what the problems are, I think we're going to get a lot of information that our normal surveys are not going to be able to pick up. So I think there's a strong link to how we do public participation that we also need to think about. Yeah.
So for the people online, these are Cape Town examples on did we bring design thinking into our tool, as well as maybe different ways of surveying and different ways of getting to people to be surveyed. I think the latter ones, Marley, are really useful to include. With regards to infrastructure, because design thinking is really infrastructure related, that was in our minds. And I know that one of the things that we have spoken about during your studies is related to that, that was brought in. If I remember it all 100%, it's actually the 49th example that we are bringing in. So it's in there. If I remember correctly, it's all now starting to blend into one. But it was definitely at the back of our minds. But this tool highlights, you know, the most urgent one from a gender-based violence and harassment point of view. If I can conclude, can explain it like that. John.
Yeah, just a quick question.
Do we have a mechanism to keep our resources up to date? We do have, and that was one of the things that was asked me to ask you, so I'm going to do that now. We do have a contract. we have a contract that our tool is updated for another X years, and I don't know, I can't remember what X is.
I mean, we've said for the foreseeable future. So the online domain is going to be continually managed, and it could be 5, it could be 10 years. So that will continue to be free to use. That doesn't quite answer your question. It's like, how do you keep it up to date? We would like, you know, somehow more resource to keep the tool evolving, and that would mean adding new case studies, but also maybe editing existing information to keep it up to date. That would require more resourcing, I would say. But I do know that the HVC program is quite fond of this project and the tool itself, and there might be ways in which we could sort of apply for more grant funding, I suppose.
But I think in Empower One, there was an updating component to it for the designers. So we just need to, and I never say we as a project, but also we as in the room and in the rest of Africa, need to make sure that the new data gets to them so that it can be incorporated. So that's an open request to all of you.
Super. Now, Marianne's been writing away and the pens have run out of ink. There's so much on those easels. So before we leave, what we wanted to do was just to get, because you're all in the room and you've all had some really good suggestions so far, we'd like to get your opinions on what do you think, having listened this morning, what are the main barriers and opportunities towards taking this forward, towards tackling sexual harassment in public transport? Because again, this is useful insight for the future of the tool. Because we're quite short of time, I think Marianne is going to explain how this is going to work.
I'm going to take this microphone as far as I can so that I can read myself. I think this is about it. That's fine. That's fine. So what I've done while we were talking, based on questions, based on the presentations, based on our discussions, etc., I have summarized the barriers and opportunities that I heard coming through. So on the barriers, and I'm sorry I'm standing with my back to you, on the barriers, misunderstanding that links to the pictograms that have been developed and that it's different in different countries and people don't understand, unsure about reporting structures, underreporting and not enough data, the culture, and even in the last presentation, religion around gender-based violence, policy and legal frameworks, fragmented implementation and responses, lack of political will, men working in transport, no gender-based violence in service or reporting structures, predetermined structures, retaliation risk also from the last presentation, and no direct feedback to SEPs and other stakeholders. That came from your question. So those are barriers that I heard. If you can think of another one like right now, then let me know before we do the voting. With regards to the opportunities, I've heard pulling resources stakeholder collaboration, campaign efforts and everything to do with that, a hotline, rethinking infrastructure, it came back now again, Marley, surveillance and policing, action plan, gender-based violence management plan, stakeholder mapping, integrated or improved policies, utilizing technologies for reporting, etc., training and education, and even education and training of the bystander. That also came out of one of the later presentations. Utilize online user data, so getting into existing information on social media, and code of conduct was an important one that I think was mentioned. That's what I pulled out. While you were talking, some of the things are summarized here, of course, very simply. So is there a really urgent one that I have overlooked? That's the first question. And I really hope that I don't get 10 hands now.
The one that might have been missed, which is, in my opinion, important, the monitoring and evaluation framework. I don't know.
And is that a barrier? That's a barrier, really, if it's not there. No monitoring and evaluation.
Okay, I think it came out in Thomas' presentation, and maybe in the other, maybe I might have missed it. In the other presentation, I didn't hear anything on monitoring and evaluation, because I think would be important in the sense that you want to see what progress has been made and the direction that therefore needs to be taken after finding that.
No, it's a fair point. I'm just wondering where to put it. Where did you put it?
Opportunity.
On opportunity. Then if you allow me, I'm going to try and stick to one page. I'm going to put it up here above opportunities.
I mean, yeah, that's absolutely right. Because it's one thing saying we need data, we need data, we need data. But if we're not then monitoring the impact, then it's not serving its full purpose.
Yeah, I think data is here. I'll go through it again.
Yeah, I don't know, maybe we can combine it. I'm thinking we should add the political priority, political will, but also political priority.
Policy is here somewhere. Integrate and improve policies. It's here. It's there already.
We mentioned something about political will somewhere. But
It's the barriers are not having a good policy framework and legal framework. The legal came directly from your presentation.
Sure, it's a barrier, but I think there's something that it has to take in mind is the expectations of people when you deploy a new anything like a tool, or because in our case, I'm from Chile in South America. If you do, you make like a website or some place that people can ask for help, people are going to expect something in return. So I want to comment before because where I think you have a question, if the tool can manage some on like lifetime
feedback. It connects to what you were saying.
And at the same time, if you use the tools that already exist, if something or other kind of complaints about public transportation, if a door is not working properly, is at the same level as I'm being harassed on a bus. So it has to be really you have to have in mind the consequences of opening space to people to complain, because they don't get a proper answer. They get disappointed and stop trusting those tools, and they stop Like,
Yeah, absolutely.
Yeah.
You know, on a different scale, we have like you know, travel surveys at employers in the UK, and if you ask your 2,000 staff how, you know, what would make you travel to work differently, and then yeah, the expectations then go up. The thing is, you're talking specifically there about the transport user, whereas the tool itself is really pitched towards the decision maker. So it would be them that would feel either that the tool has helped them choose some interventions or not, I think.
yeah, I think that how the chicken tool is managed, the way to do it, what you said is it has to be connected with some kind of, depends on the country.
Yeah.
So we have to be responsible to keep that in mind.
Yes. Okay. So
it was, I don't.
The stakeholders need to be briefed on managing expectations once they start consulting transport users, and then they're in focus groups.
Yeah,
that's a good thing.
I've summarized it, user expectations not met. So that's how I summarize. I thought I saw one in the back as well.
I think that one support the political balance coming up from there. In the fact that we do have a national strategic plan and GBV that was launched by the president.
Yes.
So we have that.
But this is African, so not political will is. So you can.
But it's a global.
Yes, global issue. Yeah.
So we've got that one there. In terms of the barriers, I think things come out quite a bit. The routes coordinated efforts as well. All the different stakeholders. It's just not going to be very fragmented. So there is effort, but before they down the line, just like what we picked up in ourselves right now.
Yeah.
It's a barrier.
Yeah, so it is there, fragmented response implementation, that is there, okay? I had a hand here, Fatih.
So maybe related to the issue of underreporting is a bigger issue is of trust or the lack thereof, specifically from the victim side.
Yeah, is that related to user expectations not met and losing trust because of it?
I think maybe for me, it's just the trust in the entire system. So people actually just feel, I think it's related to one of the presenters where people just don't actually bother because no one's going to believe them.
Yeah.
And there's no evidence to support them.
Which is why, again, you need sort of coordinated implementations. So if you put in a new reporting system or a new law that actually makes something illegal, that needs to be backed up with a campaign and
so a lot of other stuff as well.
Yeah.
Okay. Users do not trust system stakeholder, etc., etc. That's where the trust comes in.
Add one. Yeah, I think related to the barriers, the integration of those state organizations. Sometimes.
Okay, so I do have stakeholder collaboration as an opportunity, and I have where did I have it? Fragmented responses, implementation, etc. as a barrier. Does it fall there?
Yeah, we can incorporate.
If I need to add a word here, let me. Fragmentation is the big thing there. So the risk is the fragmentation. The opportunity, I think, is the collaboration.
Yeah, because even they are believing on this collaboration because of their mandates, there will be some gaps.
Yes,
It's
yes,
not like
yes.
things.
Yeah, all right. That captures it, right? So now your little moment of fame, you have your stars and you can provide stars. The silver stars go to barriers. The gold stars go to opportunities. Okay, I have put a star there to remind you which color is where. All right. If you put a gold star on barriers, you forfeit your star. Okay, then it's not counted. And you now can decide to put all your stars, you have 7 of each color, on one of these. One of the, it's all of them, or you can put it in different ones. It's up to you. We gotta see what collectively comes out of this. Please try to, if there's not enough space here, then just go towards in this direction, not sticking it on top of each other, because then I can't count it anymore. So same here, gold stars, put it wherever you think it should go, and let's see in a minute or two what comes out of it. So please stand up and vote away. That's a very good point coming from me. Okay. So that's going to be. is that we will summarize it and share it. Monitoring and evaluation 15. Pooling resources 7. Stakeholder collaboration 22. Campaigns, adverts, etc. 6. Hotline 6. Rethinking infrastructure 23. Surveillance, policing, etc. 11. Action plan 10. Gender-based violence management plan 6. Stakeholder mapping 2. Integrated improved policies 15. Technology 13. Training education, also bystanders training 18. Utilization online user data 5 and code of conduct 7. With regards to the barriers, users do not trust 23, misunderstanding pictogram related 4, unsure about reporting 10, underreporting and data 14, gender-based violence, culture and religion 10, policy framework and legal framework 12, fragmentation 19, lack of political will 17, working with men in transport being the perpetrators 4, no gender-based violence in the surveys and reporting 5, retaliation risk 8, no direct feedback to stakeholders and police 26. So it has the highest number and is really voted the biggest barrier that we have now. Very nice. And then user expectations not met 16. So I think, you know, I think what we seeing here is that some barriers have been addressed. So misunderstanding the pictograms might be helping there, and it's not a barrier anymore. That's something that I see coming out. Where else did I see? Maybe something like the code of conduct is not needed when we have a proper legal framework, etc., etc. Those are some of the indications that I see as well. And yeah, this I find an interesting one because in our work, it has been really important to map stakeholders. It doesn't have a lot of votes. So one, we have the tools to do it. Maybe it's not seen as a barrier anymore. That I thought that was an interesting one as well. So with that said, from my side, thank you, everybody. Back to you.
Brilliant. I'm glad you found the lunch because I'm really hungry. So that means I can now start eating as well. Just a thank you, really, for joining. I thought it was a really interactive session. Big thanks to all of our speakers. Very grateful for you sparing your time coming. And for further information, of course, have a look at the tool. I know you will. And the Transport Links website, that's for the high volume transport program with other similar projects. But do stay in touch. I'm sure most of you know Mariana as well. So if you have any other comments, then please get in touch. And thank you very much. And
in terms of the police sector and how do you get the buy-in? You know, in Africa, when you tell a story, it's quite different to say, and then. That's what came to mind here. Lovely, wonderful, proactive, but we need to be reactive as well.
Yeah.
And I don't see, you know, the police, particularly in South Africa, are very cavalier, very patriarchal, and to get their buy-in that gender-based violence is such a buzz term, but to get their buy-in to the fact that this is real, that you're a woman terrified to go to work every day on 2 trips. You know, I think that's essential, and we can't address everything, we can't do everything, but I think if it came from academia, that is part of the planning process, perhaps it might become way forward. Because they talk a good talk, they just don't develop it.
thank you.
very much. Then just a request from our side, would it be possible to share the presentations with the people at WEA?
Yeah, sure. We can package those up. I'll check with the speakers, but we can definitely issue something. It's yeah, we can issue that.
That's okay, that's all. It's